What is a pinched nerve? A lot of people have this question. A lot of people say, oh, it's not a pinched nerve, yada, yada. What is going on? Another term for it is foraminal compression. Sounds a little bit more crazy, so it's easier to just say pinched nerve. But what's going on is that there is a space where the nerves travel through in between two vertebrae that sit on top of each other, right? One here, one here. Well, then in the back side here, they close off and they create a space for the nerve to go through and innervate whatever organ, whatever muscle, whatever it needs to in the body. Well, if that space that the nerve is coming through gets occluded and or tightened, compressed, then the nerve bundle that runs through there is also going to get compressed. Simple math. If the disc that's in between the two vertebrae gets compressed, then that disc is full of fluid called the nucleus pulposus, and that will come out. And where does it go? Into that same space. Typically, if it goes back and to the right or the left, it's going to impact the peripheral nerves. Peripheral nerves are the nerves that go out into the periphery, the body, the legs, anywhere else besides the center. So if you're feeling this compression and the disc pushes out and touches that nerve, along with the foramen or the space, the foramen, the pinched nerve area, that's also closed off. You're seeing a total compression of that area and that nerve. So then you might feel tingling going down the legs, right? Sciatic pain, tingling going down the back of your legs to your foot, pinched nerve. Tingling going down your arm into your fingers. You're like, I feel it in these two fingers. Well, guess what? There's a nerve that runs all the way through your arm that goes into your neck. That same nerve is pinched or compressed. So that is an example of what a pinched nerve is. Now, how do you correct that pinched nerve is what we're asking. How do you take away that tingling? Okay, so through chiropractic treatment, whenever you are adjusting the spine and taking tension off the body, right? So you are now adjusting, releasing, causing a tone shift in the muscle. So the muscle isn't tight anymore, it becomes more relaxed. Now the joint can settle into a position. You hydrate the spine. So now the disc is getting full of more fluid. So now it's lifting off of that nerve. And then you give the nerve time to recover, just resting, sleeping, taking care of the body. Now that nerve and the sensation that you're feeling when it's compressed, now finally gets to drop, relax. Now the sensation goes away where it feels tingly, numb, burning, stabbing. I've heard it all. All those start to go away. And typically in my practice, we see the difference in 4 to 6 weeks of chiropractic care for the more mild to moderate cases. Sometimes for the severe cases, we see miracles and we take those all the time. But typically it takes about 8 weeks of good chiropractic care for us to see most of those symptoms and feelings and tightness simply fade away. So that is the main way on how you can treat a pinched nerve.